Hi, my name's Avery, and the job I chose was a healthcare interpreter. So, the responsibilities for the job are basically going to be interacting between doctors and patients just to help. So, there's like no misunderstandings, for example, cultural misunderstandings between the two, just because every culture is different. So, it's very important that I know the culture of like who I'm helping interpret for, and then I have to be able to use medical terms so that I can go ahead and explain to the doctor like the patient's medical history. And then after the doctor explains to me what they're going to be doing, I need to then explain that to the patient in a way that the patient's going to understand. And sometimes medical terms aren't necessarily the way a patient would understand it. That's why I need to know what they mean off the top of my head. And then for my job setting, I could do a nonprofit or a hospital. I probably would work in a hospital just because I feel like it's a fast-paced environment and I just like the idea of being in like a hospital. However, I could work for a nonprofit. With a nonprofit though, you're gonna have to specialize in the language of wherever you're gonna go and visit. Because it wouldn't make sense to go to China but not speak Chinese, because then you'd be no help to interpret between a Chinese doctor and like an English patient, or like the other way around. And then for education, obviously you have to be super fluent in the language, so it really doesn't even matter like how many years you take a class, you just have to be able to pass a test. And then you're going to have to like pass that board certification for medical interpreters, which is just a test to see how fluent you are, to see if you are good enough within that language to interpret. You also can do this certificate at like a community college. However, they do prefer that you do it at a 4-year. You can choose to major in your specific language out of 4-year, or you can major in like a medical degree such as like health science, or like nursing, and then minor in that language, just because then you'd already have that medical background. Core skills for this is obviously just going to be knowledge of medicine. If you don't understand what's going on in the hospital and the doctor is going to give you terms and you can't explain that to the patient, you being there to interpret's not helping at all. And then you have to be culturally diverse, because if you just speak the language but you don't know like their values or like what's common in their culture, it's going to be kind of hard to like prevent those misunderstandings between like a doctor and a patient, just because all cultures are different. And then you're obviously going to want to be super fluent in the language, and you have to be very patient. Whether they might struggle to understand you when you speak to them, because languages can be taught in different ways, especially like ASL, which I'm minoring in right now. So you just have to be very patient, not only with your doctor, but with your patient as well. And then for Employment Outlook, because it's in the medical field, there's always going to be spots for it, especially with like demographic change. I looked it up, and they actually on a website explained that there's a 22% chance of increase over the next 8 years, and it's going to continue to increase because our demographics keep changing and we have more foreigners coming in. For my career outlook, I could do something starting out, like, for example, Disneyland, which is where I work now. I could work in our medical office and be an interpreter between a doctor and, like, our visitors. Or I could go into a hospital and do it that way. And then the reason I chose this job was because, like, with a health science major and a minor in ASL, an interpreter was, like, the best bet of, like, what my services could go to, considering I am fluent in 3 other languages and other than English.